Hello everyone. Today we're going to talk about how to determine the cardiac axis in a heart. We're going to start knowing the leads. We have to know the leads in order to be able to determine the cardiac axis. When we're using the cardiac axis determination, we're going to use the Hex axial reference system. So you have to know where your leads go in the body. And if you're going to recall, we have 6 leads in the vertical plane. So these vertical plane leads looks at the electrical activity going through the hearts, starting from the SA node. So let's look at the conduction system really quickly. Let's draw a quick heart. We have the atria and the ventricles, and apex is sitting towards the left in your heart. And of course, the ventricles are thicker in walls compared to the atria, especially the left ventricle. So this is left side, this is the right side, because you're looking like to the mirror and you're seeing the patient there. So SA node is found in the right atrium on top, near where the superior vena cava comes in. From the SA node, this electrical activity will gonna go in the conduction pathway towards the AV node, and with the Bachmann's branch to the left atrium, and they will all come back to the AV node. So SA node is here, AV node is right here, and through there, now what are we recording in the EKG? So far we came, this is the isoelectric line baseline, which is 0 millivolts, and then we only recorded the P wave during the atrial depolarization. So atria, both right and the left atrium, right first. So we draw the first part, and then the left next. So we draw the second part of the P wave, and this is the atrial depolarization. So right now, our electrical activity right here at the end of the P wave. So what are we doing here? We're waiting. We're waiting where? We're waiting. Our electrical activity arrived to the AV node, so we're waiting at the AV node. While we're waiting at the AV node, we're recording nothing. AV node is delaying these electrical activities 0.09 seconds, and then through there electrical activity moves to the top of the septum, to the bundle of His. So at the bundle of His, there's another delay for 0.04 seconds. So during this delay, what are we recording? In the EKG, we're only recording the PR segment. So following that, now the electrical activity is in the septum and going down in the septum. First, faster on the left branch, and then on the right branch. And if you recall, the left branch is faster, so from the left side, the electrical activity moves towards the right branch, and they're coming both also towards the apex of the heart. So what are we recording? During the septal depolarization, we're recording the Q wave, and following that, while Purkinje fibers are depolarizing the ventricles from inside out, from endocardium towards epicardium, now we're recording the R wave. At the very least part of this ventricular base, the base of the ventricle, now we might be recording the S wave. So we have here P wave, the Q, the R, and the S. So again, P wave is the atrial depolarization, and our Q is the septum depolarizing, and R is the ventricles are depolarizing. And where is the direction? Inside out. The S wave is the base of the, especially the left ventricle, so the base of the ventricle depolarizing. So majority of the electrical activity moving from SA node to AV node, and then it is coming from septum down towards the apex. And since the left ventricle is much thicker, so the axis sort of deviates towards the left ventricle. And now during the depolarization, it will gonna go to the opposite way. So now it will gonna go where it came from. So it will gonna go from apex towards the base. This way we have an electrical activity and repolarization that is going away from our positive electrode, which we're going to talk about those in a second. So we are recording now a positive T wave. All right, so this would be the T wave. T wave is the repolarization. So let's put that too. T wave is the ventricles repolarizing. And there we go. So this is the pathway of the electrical activity through the heart. So they start at the SA node, and then we start recording the P wave. First, like we said, the right atrium, then with the Bachmann's bundle, the left atrium. And now our electrical activity arrived to the AV node, and during the delay, we're only recording this PR segment. So when we look at the segments from the beginning of the P wave until the very beginning of the Q, this is PR interval, but from the end of the P wave until that beginning of the Q, this is called PR segment. And during PR segment, there is 0 millivolt, basically no electrical activity. Why? Because we have the delay in the AV node and the delay in the bundle of His. Following the delay, as soon as our electrical activity gets onto the septum and starts moving down in the septum from left to right, from left bundle branch to the right bundle branch, we're starting to record the Q. And then as the electrical activity coming from inside out still towards the apex, then we're recording the R. And then at the very end, when the base of the ventricles are polarizing, we're recording the S wave. And of course, the repolarization now is the opposite wave. So now we are, during the repolarization of the ventricles, we are recording the T. What happens ST segment? Here, to beginning of the T, any line that is flat is called a segment. So this one is ST segment. This is the quiet time. Looking at the ST segment, seeing if it is shifted from the baseline or not, will give us clues about ventricular injuries. So it is very important to see if there's any ventricular injury. And looking at the PR interval, so the atrial depolarization including the delay, PR interval length or duration should be between 0.12 seconds to 0.20 seconds. So if this is normal, we have a normal depolarization of the atria followed by a normal delay in the AV node and the bundle of His. But if this is longer than 20 seconds, then we should always think of, if you see a nice P wave, but still PR interval being longer than usual, then we should think of AV blocks. Why AV blocks? Why is not SA block, for example? Because we do see a normal P wave. The P wave, if you're seeing it, that means the SA node started the electrical activity, and as the atria depolarized, we did record the P wave. So that means there is no problem with the SA node. But this length still being more than longer, that's telling us the delay here, maybe it's abnormally long delay. So we are blaming the AV node and saying this is an AV block. And the block is at the AV node. The location of the block is the AV node, basically. Another thing is that will gonna give us a good clue is the QRS complex. duration. So the QRS complex duration in a normal person should be around 0.6 to 0.8 seconds. Okay, this is normal, but yet up to 0.10 seconds we accept it still as normal. But if it is longer than 0.10 seconds, then now we should think of there's a problem during the ventricular depolarization. Where could be the problem? Well, if it's the Purkinje fibers, there are so many of them, it doesn't make sense. It shouldn't delay that much any electrical activity. But let's pay attention to this septum again. What do we have in the septum? Only a left bundle branch and a right bundle branch. The left bundle branch goes to the left ventricle. The right bundle branch goes to the right ventricle. So if one of these is blocked, imagine this being like a two-lane car. So if one of them is blocked, that side will gonna not have an electrical activity, a depolarization on that ventricle, but the unblocked side will gonna reach to the destination on time, and as that one reaches on time, it will gonna record an R. And let's say in this case that our right bundle was blocked. So the right bundle, the right ventricle will not be depolarized on time, but the left ventricle will depolarize right on time. And as the left ventricle depolarizes, we will record this R. So what does that mean? If you have a blocked lane, will you, like at a car accident or something, will you never go home? Of course you will go home. You will find a detour and you'll make it to home with a delay. So that's what this side will gonna do. The right side will gonna find a way, a detour, to go to the right ventricle, and the right ventricle will depolarize maybe with a delay. So now what do we see? We see the peaks of 2R. So what do we call this? We call this bunny ears, or R prime. That's what we call these things. So R prime. There are, of course, different versions that it can show itself, not just with an R prime, but it can be also an S or S prime, but we're going to talk about those later. So then what does that mean? If you have a QRS complex that is taking more than longer, then that means our bundle branches are to blame. So we say there's a bundle branch block. So B, B, B. All right.